I'm here talking to Grace Bottoni, who is one of the core partners in a project that the Elton John AIDS Foundation runs, a social impact bond for HIV in South London, which is essentially about trying to find people who may be living with HIV and don't know it and haven't been diagnosed, and make sure that they get on treatment and get the support that they need. Grace, tell us a bit about where you work and your involvement in this program.
I'm a GP and I'm working in Lewisham, which is in southeast London. And I'm also part of this GP federation called One Health Lewisham. And we're a group of 35 GP practices, and we look after roughly 300,000 people in Lewisham. I'm one of the project leaders for this social impact bond. That's sort of my main role.
I can only imagine what life must be like at the moment doing your job. Can you tell us a bit about what it's like at the moment?
So obviously it was very, very difficult right at the beginning. We were in a state of medical emergency and we didn't know much about COVID-19, and we had to stop seeing patients face to face. We had to deal with lots of things over the phone, which makes it very difficult for us, GPs. As time went on, we've managed to adapt really quickly, and we are sort of trying to help now our patients as well as our staff adapting to what we are coming to as a new normal.
Yeah, because your team must be finding it pretty stressful as well, I imagine. We're in uncharted territory, as you say.
Exactly, but we're working really much more closer as a team. We have daily huddles in the morning in our practice, which is very useful to find out more about the updates about COVID-19, also find out about the changes in our surgeries, and to troubleshoot any issues that we have. And actually, we like that team spirit so much that we're going to take the huddles forward.
It's interesting, isn't it? Because we've got an office in London and one in New York, and we've often felt a bit separated or isolated. And I must say, one of the things that this lockdown has done is it's really made us all feel incredibly close as a team. One thing people might wonder is, in this environment with COVID going on, and HIV is obviously still quite a sensitive disease to talk about, why do you think it's still important to keep diagnosing people with HIV in this environment with all of the challenges that we're facing with the coronavirus?
I mean, obviously, it's still just as important as it was before, but more importantly, I guess, is because if someone is HIV positive and doesn't know it, their immunity can become really low, and it can put them at greater risk of developing a more severe infection, and ending up in hospital. So we need to make sure that people know their status even more so during this time.
Yeah, absolutely. What are the biggest challenges facing people living with HIV that you're hearing about from the patients that you work with?
In London, there are probably two main challenges that we face. London has the highest number of people living with HIV in the UK, but 1 in 10 of those people don't actually know that they have HIV. That is, a huge challenge, because they won't know that they have HIV, so they won't be on treatment. And also they are at greater risk of passing on the virus to someone without knowing it. That's a big challenge, not only for that person, but also for healthcare professionals to try and find who these people are. And the second challenge is really the stigma that's associated with HIV still. In London, we're very lucky. We have lots of different people from different backgrounds. There's different ethnicities, different religions, different health beliefs, but all of these contribute to different kinds of stigma, and that makes it very difficult for patients sometimes to have a test because of the stigma, or even to accept the diagnosis of HIV, or to even go to a clinic, and then more importantly to take their treatment. So that is a huge problem that we face at the moment in London.
It's funny, so much of what you describe about people needing to know if they're at risk, taking a test, getting medication if they need it, all sounds exactly like the conversations that people are having about coronavirus. There's a huge similarity, isn't there? And even with the stigma, it's interesting, someone I know who got diagnosed with COVID very early on, she was saying that, you know, it wasn't much fun to have it, but that one of the most difficult things about it was having to call 5 or 6 other people and say, look, I'm really sorry, but I think I may have put you at risk. And it sort of had that echo of what we worry about with people living with HIV, that there's this stigma about infectious diseases and this real concern that people have that can sometimes mean that they don't actually tell other people because there's a real fear and a shame associated with it sometimes. How do you and your team make life easier for people living with HIV? What can you do to reassure them or support them?
Well, I mean, going back to your, COVID example, I was contacted by someone saying, I might have put you at risk and you actually need to have a test. And yes, it was a bit of a shock, I have to say, wasn't expecting that call, but I was really grateful for that to have happened. And I felt a lot better knowing rather than not knowing. That can sort of be in the same way as HIV. Yes, nobody wants to receive that call, but actually it's way better to know than to not know. So that's how we sort of explain it to our patients when we offer routine HIV tests. It's better to know your status than to not know at all. So we try and help them deal with uncertainty, and with the fact that, yes, if you are positive, it's going to be a shock, but actually there are so many things that we can do about it, because if you are on treatment and you take it correctly, then you can lead a completely normal, healthy life, and actually you won't be able to pass on the virus to anyone else, which is fantastic. We need to tell and educate our patients, because that's changed dramatically compared to 20 years ago, but there's still a lot of misinformation out there.
It's so true, isn't it? I mean, I find that very, very few people actually know that fact, that if you're on treatment and the virus is suppressed, you're not going to get sick and die, and you're not going to pass HIV on to anyone else, and you can live a completely normal life. And I guess we just have to keep shouting that as loud as we possibly can, and saying it as often as we possibly can. We know it's a huge challenge to talk to people about HIV, because people then think you've made assumptions about their sexuality or about something to do with their private life. Is there a way to sort of have that conversation? I know a lot of doctors have found this very difficult. They feel like it's not an area that they want to get into. Is there a way to have that conversation which doesn't feel judgmental or threatening or whatever? We'll come on to this, but I know you're very good at this, so I'm intrigued to know how you do it.
Well, it takes a lot of practice, first of all, and it's it is something that the GPs in our community have had difficulty with. What we have found is that the best way to explain it to someone is that the HIV test is just a routine test, just like any other test. So we have lots of patients that come and ask for a routine cholesterol check or a routine diabetes check. Mm-hmm. And asking for an HIV test is just like that blood test. You should be checking it every year because it's part of your health checkup. And HIV can affect anyone, despite of your sexuality, gender, religion, ethnicity. It can affect anyone. So we should all be checking it routinely.
Yeah, and I remember, it's quite a long time ago now, but I can remember when I was pregnant with my son, that you asked as a matter of course, we're going to test you for high blood pressure, for syphilis, for a number of different things, and every pregnant woman got the same message, and HIV is going to be one of the things we test you for. And I found it fascinating that, if you ask people, we're going to test you exceptionally for HIV, it feels like it's a judgment. If you say, we're testing everybody for this because it's good public health, it's much less threatening, and it feels like people are much more comfortable with doing it.
Exactly.
One of the things we should say about the social impact bond, it's unusual in the sense that it's very much a sort of pay by results system. It's designed to find as many people as possible and to support as many people as possible. So it's a different mechanism. But I'd love to know I think the whole country has just been so full of admiration for the work that doctors like yourself are doing. What keeps you going at the moment? There are a lot of uncertainties. There's a huge amount of work. How do you and your team motivate yourselves to keep going?
In terms of the work that we're doing with our HIV patients, what keeps us going is all the success stories, really, that we're having despite lockdown. So we have managed to re-engage 2 patients back with their clinic, their HIV clinic, which is extremely satisfying despite these difficult times. And so we know that we've helped at least 2 patients, hopefully prevented them from becoming extremely unwell. And we are also slowly reintroducing routine HIV testing as people are having their routine blood tests. There's actually research out at the moment saying that the rate of new HIV diagnoses has actually gone down because of lockdown. So actually we need to use this opportunity to try and break the HIV transmission cycle by trying to identify as many people as possible who are HIV positive, so as to start them on treatment. And then if they take their treatment correctly, then they will not transmit the virus to anyone else. This is a really great opportunity for us to actually try and end HIV in London. So yes, it is a challenge, but it's actually a really good positive for us at the moment.
Maybe it's not more generally known that there really is this possibility to, using another COVID phrase, break the cycle, as you say, and to end HIV, which would be an absolutely extraordinary outcome, wouldn't it? Obviously, very, very few people die of AIDS in this country anymore, but to really reduce the amount of infection down to kind of tiny levels such that it's just not an issue anymore would be absolutely be something that the UK and London should be incredibly proud of.
Yes, exactly.
So Grace, the social impact bond is obviously quite a complex kind of structure, but can you explain to us in really simple terms, what do you do for the social impact bond? Like, what does your work look like for this project?
RSIB has 2 main outcomes that we need to try and achieve. So the first outcome is to try and find new HIV diagnoses. And the second outcome is to re-engage patients who we call are lost to follow-up. And that means that they haven't been seen in their HIV clinic for at least a year. And that normally would imply that they're probably not on treatment anymore. So they are at greater risk of infections, and also they can pass the virus on. The way that we tried to achieve these outcomes was we looked at our data, our local data, and we found that people tend to prefer to see their GP rather than going to the STI clinic for an HIV test.
And that's because going to a sexually transmitted infections clinic sort of says things about you and your sex life that you might not like, or
yes, or some people are worried they might see people that they know there, or they feel that they don't fit in there because they're of a certain age and they shouldn't be having sex, or there's lots of different stigmas attached to going to an STI clinic. And most importantly is that we found that roughly a person will go and visit their GP 3 times a year.
Okay.
So we knew that there was this huge, pool of patients that we can actually offer a routine HIV test. So we sort of decided to make sure that in all of our GP practices in Lewisham, we would offer an HIV test to any person having a routine blood test at their GP practice. So we've managed actually to identify 9 new cases of HIV in Lewisham in the last 12 months, purely by doing routine testing, which is fantastic.
It's fantastic. And I think it's sort of important to say, because, you know, you might listen to this and think, well, 9 people, that doesn't sound a lot of people, especially when we're hearing nightly about hundreds or thousands of people becoming infected with the coronavirus. But actually, because HIV is a complex and expensive disease to treat, if you're not diagnosed early on, it's actually really significant, isn't it, to find 9 people and know that those 9 people can go on treatment and then won't be infectious.
Absolutely. And, you know, like you said, they're not, you know, they might have ended up in hospital and taken up a bed, and, you know, then, you know, especially in this medical emergency, we need all the beds that we can find in hospital. So we are helping, you know, the general medical response as well for COVID-19. And so that's why that was really encouraging and really important. And then in terms of our loss to follow-up, we identified all the patients in Lewisham who were known HIV positive by their GP practice, and we looked through at who was maybe not engaging with their clinics, and we did hundreds of phone calls, and the GPs did hundreds of phone calls, and the clinic did hundreds of phone calls, and so far we've managed to engage 7 patients back into their clinics. And again, that's important because they're back on treatment and they are all doing really well, and we've hopefully prevented them from becoming really unwell during these times. And they are, you know, if they're taking the treatment correctly, they're not going to be passing on HIV to anyone else, which is the best outcome we could hope for, really.
Yeah, that's amazing. What did you learn about why people fall into this loss to follow-up category? What kind of things mean that they drop off the treatment?
I mean, as I said, there's, because of stigma and because of, you know, generally life gets in the way sometimes. And there can be quite complex cases.
So we're talking a lot, obviously, about testing for HIV, and tell us actually how complicated or how difficult is it to have an HIV test?
I can't emphasize how easy it is to have an HIV test. You can go to your GP practice, you can ask just for an HIV test, which is a simple blood test, or if you're having a test for anything else like your cholesterol or your sugar or your, you know, vitamin D level, they just add it onto the test. So it's not an extra test as such, they just add it onto the sample that they've already taken. So it's super easy. And then if you want to do it at home, you can either order a testing kit at home, and it's just a couple of drops of blood, and then you send it in the post, and then they text you your results. So it's really easy.
Yeah, super easy. And I know that, you know, in other parts of the world, and hopefully will come to the UK, there's even now a test which is just an oral swab where you run it round your gums and it gives you a result in kind of 20 minutes. So Grace, while we're talking about testing and the work that you're doing with this project and through your GP practice, does that add a lot of extra time or expense to your normal day?
So, you know, obviously, yes, making phone calls, you know, can be very time consuming, and adding blood tests does carry, you know, a certain amount of cost, but it is very minimal in comparison to the cost that we're saving when we do identify patients who are positive and we re-engage patients. Because had we left it and not identified them and not re-engaged them, the likelihood is that they would become very unwell and, you know, end up getting treatment in hospital. And that is, you know, can be extremely expensive. So if you add it all up, we're going to be saving a lot of money for the NHS.
Absolutely. And not to mention the distress of the person who doesn't find out about their diagnosis until they're sick, which is such a completely different thing from finding out when you feel entirely well and normal. One of the things that I think is really interesting about this work that you're doing is it's true to say that people perhaps have a bit of an idea in their head, a profile of the kind of person who's at risk of HIV. But I know that you found quite a lot of people through this work which don't fit the profile, which only underscores your point about, not making assumptions about who's at risk. Is there anything you can tell us a little bit about how what you've been finding has been surprising?
I mean, yes, you're absolutely right. 20, 30 years ago, everyone just sort of thought that, HIV affected young gay men. Obviously, yes, they are still at risk, but it's not, all of the people that have HIV. Especially in Lewisham, we have, women, older people, in their 40s, 50s, and, from different ethnicities. And obviously the great thing about routine testing and universal testing is that it bypasses all the, judgments and profiles, and it just tests everybody. So we can, identify as many people as possible who probably don't think of themselves at risk. We actually had a patient who was found to be positive on just a routine new patient health checkup. And yes, he was obviously extremely shocked, but he was extremely grateful to the GP practice, because he said that he would never have asked for an HIV test, and because he just never really thought he was at risk. He is now on treatment and he's doing really, really well. So that just goes to show that we need to get rid of all these profiles and just offer testing to everyone.
Yeah. And obviously this is one of the things we're hoping will come through from the social impact bond, is the value of, not in exceptional circumstances saying to people, we think you need an HIV test, but just saying we test for HIV because if we can find you quickly and we can get you on treatment, it's so much better for you and everyone else, and also has less risk and expense and everything when the NHS is coping with an awful lot of other really challenging problems. To get someone on treatment when they're well has a very good prognosis. If you could wave a magic wand, what would be the perfect kind of HIV service delivery 10 years from now? Is it something where we'd all come in and have an HIV test and a blood pressure and blood sugar and all the things that, are of risk?
Absolutely. But it doesn't even have to be in 10 years' time. That's what we're trying to do right now. We are trying to, get everyone to have it every year in our practices. We want all the healthcare professionals to be really comfortable requesting the tests. We want all the patients to be comfortable having one, understand the importance of it, and understand that, HIV is just like having, a chronic disease like diabetes or asthma. If you're on treatment and it's managed, you can live a completely normal, healthy life. We want people not to be ashamed to have to go to an HIV clinic. We want them to feel comfortable taking treatment and not have to hide it away from their family or friends. That's what we want, and I'm hoping that's not going to take 10 years, and that's what we're working on our social impact bond, is to make it a more sort of a reality in the next few years.
Well, I feel like with the coronavirus that has sort of shocked us all so much and has come from nowhere so quickly and caused such devastation, I feel like maybe it's changed our attitude to knowing what our risks are and mitigating those risks, rather than waiting till you get sick and then assuming that you can be treated. So maybe there's a mindset there that's changed. Certainly I would feel very comfortable and reassured to be sitting in front of you if you were my GP and you were giving me this information. I think, what you're doing is amazing. We're deeply, deeply grateful to you. I think that the social impact bond, as you say, can really provide a huge amount of impetus to getting to the end of this problem about people not being aware of their status or being scared to test. Any final thoughts before we end and we leave you to go back to your day job?
I just want to thank the Elton John AIDS Foundation for the funding and the support that you've provided and guidance to make our project such a huge success in Lewisham. And I want to thank all the GP practices and GPs in Lewisham to rise up to the challenge and to be committed to improving HIV care. And anyone watching this video, you can request an HIV test at your GP practice. It's free, it's easy. And if you're in Lewisham, you can even request an HIV test kit to be delivered to your home for free. And I just wanted to thank Anne, for having me today and sharing, what we're doing. So thank you.
Pleasure. Well, it's lovely to talk to you. Good luck with all of your work. If you are watching this video, there's more information about the social impact bond and what it's achieving, and also links to medical guidance in terms of HIV and particularly with coronavirus and so on, and some of the links that Grace is talking about where to get a test. But thank you so much. It's been wonderful to talk to you. Keep up the good work. Let's make London HIV free. Thank you. Bye. Bye.